Nurses at Northside Hospital are going on a 24-hour unfair labor strike.
Good morning, Len. Well, as you can see behind me here, nurses have already began to gather for this 24-hour strike here at Northside Hospital. It's set to start here this morning. They are concerned over patient rights for them, patient advocacy. Patient care!
Fighting for our patients and our community. A little bit of dignity. We are the nurses, mighty, mighty nurses. Fighting for our patients, fighting for our patients.
Whose community?
Our community!
The nurses at Northside Hospital are committed to this community. Most of us have been raised here, some of us born at this hospital. So the reason that we're doing this is so that we can protect the members of our community that we are devoted to. It's nice when you have your neighbor come up to you and say, I'm going to be in the hospital, my husband's having this surgery, will you look out for me? We want to be able to continue to do that. We want to protect our community. We want to be able to deliver the best possible care. We have always done it. Our numbers support that, and we want to continue to be able to do that.
If you don't have registered nurses at the bedside, there is nobody to speak up for the patients. Long term, I think what we're trying to achieve is that we will have an established staffing pattern that CHS will stick to, one that all of us can agree upon that will deliver quality patient care.
This is a tremendous display of solidarity and unity, and you don't see this huge turnout early in the morning. People walking off the night shift and joining their colleagues out on the curb, unless there's a passionate motivation to protect their voice, to protect quality care, safe patient conditions. And I am so proud to be back in my hometown walking with Northside Medical Center nurses.
With minimal help, all you can do is what's necessary. Sometimes what necessary isn't good enough.
The acuity of the patient, it's all gone by the wayside. You know, it's just a numbers game with them. And you just can't treat patients that way.
We need more hands on the floor. I can't do everything. I can't do the social worker's job, the secretary's job, our PCAs, and we just have so much on our hands that we cannot do patient care.
And that's why we're here to stand up for the patient and to give them what they need.
The care is primary to what we do and to this community. So the cause is just so righteous here. We have to win. We will win.
I love those funky words. What's at stake is your ability to continue to provide award-winning care.
We are all about taking care of our patients and patient safety, and you need staff for that. And the do more with less philosophy doesn't work in healthcare. It may work in other industries, but in healthcare, it's not safe.
The patients are very understanding, but you know, I want to give like 110%, but at times I can't do it because it's just not possible. We are going to fight until we get a fair contract and it's best for patient care, as long as it takes.
We need people to help us staffing. They're laying off aides and secretaries and respiratory therapists. You know, if I'm answering the phone, I'm not at the patient's bedside. If I'm running up to the blood bank to get a unit of blood, I'm not at the patient's bedside. If I'm taking out the overflowing linen, I'm not at the patient's bedside. I need to be at the patient's bedside.
Hey, 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 patient care.
You shouldn't be so short-staffed that if an emergency arises, you're scrambling or you got to hold up a doctor's case because you don't have a nurse there. In order to get those patients the care that they deserve, we're willing to make a stand.
A lot less patient care going on than I thought there would be, and as a new nurse, that's really disheartening. That's what I came into this for, and I love the group of nurses I work with, and I've learned so much from them because they're all senior nurses, 25 years plus experience. And it makes it hard to make the decision that I've made in the last couple of days, and I'm leaving. Going to another job because of what's been going on. I can't work 12-hour days with 2 nurses on a floor for 10 patients, no aide, no secretary. My decision stemmed to leave. When I went home a few weeks ago, my daughter said, "I wish you wouldn't have went into nursing." And I said, "Why?" And she said, "Because you come home every night and you're stressed out." She said, "I thought you would love your job, and every day you come home, you're stressed." Actually, 5 new nurses left my floor in the last 5 months.
Not only are young nurses not coming, old nurses are not staying. So recruitment and retention has become a problem. And in this contract that's on the table today, presently, they're proposing even more ugly things that will make people think twice before they work here. And that's sad. Nurses make a difference in patient outcomes. Everybody knows that. It's a proven fact. There's research to substantiate it. We use the Quality Council here to make our case every day, and we're just ignored. And I hope that this wonderful day helps carry us through the possibly difficult days to come. I really do.
You know, we are not going to give up on this whole issue of safe patient staffing. It is imperative that we have the qualified nurses at the bedside to give and deliver the care that these patients need, and we will not give up on this.
And it's a unified effort. We will get a fair contract for the nurses, for the patients they serve, for this hospital, and for the community. We will prevail.